One of the conditions that's becoming increasingly more diagnosed in dentistry is a temporomandibular disorder. Temporomandibular disorder is any pain of the musculature that's controlling the joints or an internal problem within the joint capsule itself. Patients who are experiencing these types of pains very often can become disabling. So it is important as an orthodontist to recognize the likelihood of a patient developing these types of problems. Unfortunately, when a patient comes in for orthodontic treatment who's already been diagnosed with a temporomandibular dysfunction, we have to be very careful in our approach to treating these patients. Getting started too quickly may exacerbate the problem or make it worse, so diagnosis in the beginning and understanding the condition and why the problem exists in the first place is a critical step. And I always will describe to my patients that I like to wade into the water on a TMD patient. I'm not jumping in, I'm walking my way in, dipping my toes in first. And by doing so, I'm not jeopardizing the potential to make matters worse. TMD as a problem has to be managed very often. And the thing that we strive for in dentistry is to try to minimize the likelihood of that patient developing pain. And if they've shown those problems in the past, we have to be very careful in our approach to treatment.